Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of April 3rd, 2023. After a COVID status update, I'll provide an update on Mpox as well as some news regarding Xylazine. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Worldwide, it's getting much harder to really wrap our arms around how things are going with the pandemic. This map from the World Health Organization is showing total cases, not new cases. New cases have become quite unreliable, and we're still trying to determine which countries are reporting in a reliable way. And what I mean by that is, where in the world will cases be a good indicator of the direction of the pandemic? But here you can see overall where the burden of cases are, and this is no surprise based on what we've experienced throughout the pandemic so far. I don't quite have an answer for which countries will serve as our best indicators or bellwethers, but we do know that there are upticks currently around the world. You may remember early on in the pandemic, Iran had some of the world's earliest and most terrible outbreaks in 2020. And after a couple of very difficult years, they were seeing some relative calm, but unfortunately, in the last 24 hours, they've seen over 1,000 cases, almost 500 hospitalizations, and 23 deaths. This represents Iran's 8th wave. The country's health minister there is advising the use of masks to slow transmission. We're also seeing headlines of a surge in India, where they're seeing the fastest increase in cases since their 3rd wave in January of 2022. And as I reported last week, here in the United States, we're actually not seeing any change here. About 53% of the nation is in substantial or high community transmission. Remember, community transmission is a function of new cases, which we know are undercounted, as well as the positivity rate. Taking a look at wastewater data on the CDC map is a little frustrating at the moment. All of those dark gray dots, which there are a lot of them, means there's no recent data for those wastewater sites. So we know that wastewater surveillance is not going to be very helpful if it's not updated on a regular basis. So we'll keep on watching for that. When we look at variant proportions, we can see that XBB.1.5, which is by far our most dominant strain, has come down just a bit from over 90% last week to under 88% of projected specimens this week. XBB.1.16, which seems to be the variant responsible for the surge in India and possibly driving some increases in the UK, is not yet over 1% in the United States, so we're not seeing it reflected on the variant tracker. We'll just keep an eye out for that. XBB.1.9.1, on the other hand, has increased rather significantly. It's now at 4.6%. from 2.5% last week. So this is more than an 80% jump. So this could be what is displacing the XBB.1.5 and causing it to trend down a little bit. XBB.1.9.1 seems to be possibly driving some increases in Australia. And even though it's 4.6% of samples nationwide on average, you can see that it's variable across the different regions of the United States. It's that bright blue color there. And you can see that region 7 represents about 16% of XBB.1.9.1. So for whatever reason, it is quadruple in that region center in the middle of the United States there compared to the national average. But for the most part, we're still mainly dealing with XBB.1.5, so we'll just have to see how things progress. Unfortunately, when we look at daily deaths, we're still seeing an average of 298 deaths per day in the United States. This equates to over 2,000 deaths per week. And we've been kind of stuck here around about 2,000 deaths per week for quite a while now. We have not been able to get down to the lows we saw in the summer of 2021, and that was before we even had the treatment Paxlovid, or even down to what we saw this time last year in April 2022, when we actually had the lowest single week of deaths, somewhere around 1,350. And since then, we just keep posting the same or more deaths every single week. And this is, of course, concerning. When we think we're learning more, we're getting more tools, we're getting more information, but we're not really making a dent in deaths. So far to date in 2023 in the United States, over 36,000 people have lost their lives to COVID-19. When we look at hospitalizations nationwide, we can see that overall they are trending down, but again, still too high. We can see that we got to our lowest COVID hospitalizations in the summer of 2021, and then we reached another dip in the spring of 2022, but that low was actually higher than the low before it. And then the next dip we had was in the fall of 2022, and again, that low is much higher than the low before that. So we never want to see our baseline creeping up like this, because even though we can see that the highs are not getting as high, the lows are also not going as low. And so unfortunately, this could lead to the same net effect of just too many deaths every week, every month, every year. Taking a look at the state of California, we are mostly in the moderate transmission, but we do have 5 contiguous counties here in the Bay Area that are in substantial transmission: San Benito, Merced, Santa Clara, Alameda County, and San Mateo County, and then also down south in Orange County. And we have some high transmission going on in Southern California, Inyo, Kern, and Imperial counties. Looking at hospitalizations here in California, we can see a very similar trend to what I just reviewed for the nation, where the lowest low was in summer of 2021. The next lowest was spring of 22, but that low was higher than the one before it. And the next low in fall of 22 again was higher than the one before that. So we will see what comes next. But again, with increasing tools and increasing time, we'd like to see the lows getting lower, not higher. Here in Alameda County, once again, a little bit difficult to know exactly what's going on. Total cases over 14 days just appear to be kind of flat. The bottom graph there shows the number of PCR tests that are actually being done, and that number continues to creep down. So the lower that number gets, the number of actually reported tests, then the less reliable the case results. So we'll just keep an eye on it for any notable trends, but this is getting less helpful. When it comes to percent positivity, we're still at about 5% positivity, which is still high, but again, difficult to interpret this one because this is dependent on what small subset of the population is actually getting a reportable test done. One place where reportable tests are being conducted is in the hospital setting. And we know that unfortunately many hospitals are actually reducing the amount of testing that they're doing, but this indicator will become more increasingly of interest to us to help us understand the status of the pandemic, because we know that there is still testing happening in those hospital settings. Currently in Alameda County, we have 80 people in the hospital, 16 of those are in the ICU. And again, we can see basically the same trend that I just pointed out for the US and then again for California, where the low points in our troughs, or the low parts, are getting higher and higher each time. So we don't want to see this baseline creeping up, because again, even though the highs might not be as high, if the lows are not as low, we're going to end up with the same result, which is just too many deaths over time, too many deaths every month, every year. Looking at wastewater for Alameda County, it still looks about the same as before, relatively low, but the last data point we have there is from March 23rd, so lagging more than a week and a half behind. Not super helpful, but when we look at wastewater concentration in the city of Oakland, and we have the last data point there much more recently in March 30th, and we are seeing a little bump up there. We can also see that dot that's pretty high up there, which is a data point that represents a raw sample value from that collection date. So right now, we'll certainly just watch and report these things, but really we're looking for some type of correlation between when the wastewater goes up compared to when cases, hospitalizations, and deaths go up. So this may be a bit more of a long-term endeavor to try to figure all of this out. Now I'm going to turn our attention briefly to Mpox or MPX or monkeypox. We all remember the 2022 outbreak. The majority of cases worldwide were right here in the United States. You can see it there in the light blue. And in the United States, we had over 30,000 cases and we had 38 deaths. A recent report was put out by the CDC just a few days ago on March 30th, and it was assessing the risk of a resurgence of Mpox here in the United States. Now, we know that Mpox came down considerably and fairly quickly, mainly because of widespread vaccination efforts in the populations that are at most risk, but we do still seem to have a ways to go. So basically what this analysis showed was that in most areas of the United States, the risk of a resurgence of Mpox is greater than 35%. And that outbreaks in some of these communities could be just as big or even bigger than what they were in 2022. And this is because immunity is relatively low in the populations who are the most effective. And this includes sexually active men who have sex with men in those areas of the country. And those areas are the same areas that had large Mpox outbreaks in 2022, like here in California, also in DC, Illinois, and New York. And this graph is just basically showing that as the percentage of the population with some immunity goes down, so you can see across the bottom there, on the left, you have 100% immunity, and then you have a very low chance of an outbreak. And as you go out to the right and you get down to zero immunity, then your risk of an outbreak gets rather high. And it seems that most of the jurisdictions that had significant outbreaks are somewhere in the middle, resulting in that 35% or so or more chance that we will have an outbreak that looks as big or bigger than last year. The good news is that Mpox is pretty slow moving, unlike SARS-CoV-2, and we should definitely be able to get out ahead of it. And that means mainly vaccinate. And here is the list of priority populations for receiving an Mpox vaccine or Jynneos vaccine. Remember, this vaccine is a 2-dose series. We know a lot of people got 1 dose, might not have gone back to get the 2nd dose, which is really what you need in order to be fully protected. The majority of people who do contract Mpox recover well, but we do have some who have a very painful and prolonged and maybe even a difficult course. And I mentioned we even had 38 deaths, and most of those deaths were in people with untreated HIV. So the moral of the story here is anyone who is HIV positive should be vaccinated for Mpox with that 2-dose Jynneos vaccine. Anyone who's suspected of having Mpox should be tested for HIV. And in the event of catching Mpox, those who are HIV positive might need to be treated a bit more aggressively, like being admitted to the hospital for IV antivirals to prevent some of those more severe outcomes. And lastly, I just wanted to bring to your attention a health advisory that was just released by Santa Clara County about a death in the county due to Xylazine. And just about a week and a half ago, we actually had an advisory coming from the state as well, California Department of Public Health. But this is the first death that we've had in Santa Clara County from Xylazine. It's a 36-year-old man who unfortunately lost his life. And Xylazine is actually a veterinary tranquilizer. It is used to tranquilize large animals like horses, and it does not have any approved usage in human beings. But nonetheless, there have been reports of Xylazine making its way into the drug supply, into the opiate drug supply specifically, such as heroin or especially fentanyl. And xylazine, as I mentioned, is a tranquilizer. So it seems to either add to or prolong the effects of fentanyl. And it's been increasingly found in the fentanyl drug supply. Xylazine can lead to fatal overdose, especially because it's a tranquilizer. It's actually called Tranq or xylazine, and it is a tranquilizer. And when you combine it with an opioid, another sedating drug, then you can end up with overdoses and overdose deaths. The other thing about xylazine is that it can cause some very nasty wounds on the skin, which I'm not going to show here, but you can certainly look them up. They can get rather severe, and the skin can kind of die, and it can be very, very difficult to treat. And the majority of overdoses that we've seen so far in the United States have been in the northeast part of the US. That's the area that's been the most affected so far. There have been a lot of reports out of Philadelphia, but according to this report, we should be concerned about it expanding west, and we should be aware of it all across the United States at this point. The other bad thing about xylazine is that it does create dependence, and so someone can have fairly severe withdrawal symptoms. Although they're not fatal or life-threatening, they can be very severe, which then can make the person want to go out and obviously use again. And so this dependency, of course, puts people at greater risk of overdose. And I have not seen this part talked about publicly yet, but I am aware that xylazine can actually be monitored in wastewater. So another great potential application of wastewater surveillance. Hopefully we can see it put to good use. Just a reminder that if you or anyone you care about uses opioids, whether that is pills prescribed by the doctor or something that they obtain another way, heroin, fentanyl, etc., Narcan should be handy. And that is a way to reverse the effects of fentanyl or heroin and prevent overdose and overdose deaths. So that is naloxone or Narcan. Doctors can actually prescribe it, and there's a number of community-based organizations, including at Roots, where we do distribute naloxone, and this should be used regardless of the xylazine situation, because like I mentioned, we've really only seen it in combination with opioids. So if you suspect an overdose, then there is really no harm at all in using Narcan or naloxone in those situations. And just a reminder that the COVID-19 pandemic continues to constitute a public health emergency of international concern. SARS-CoV-2 is continuing to circulate significantly in our environment. It is the third leading cause of death in the United States. It's also a leading cause of hospitalization and even death in children, even children who do not have an underlying condition. And the best way to prevent hospitalization and death in children is absolutely vaccination. Remember that we have great treatments for COVID-19, but you've got to diagnose it and you've got to start the treatment quickly, generally within 5 days, and the sooner the better. So know where to get tested and know if you are someone who will be treated if you test positive. Make a plan now with your doctor before you get sick. And if you don't have a doctor, please get one. And remember to reduce your chances of infection or reinfection. Gathering outdoors is safer than indoors. If you're going to be indoors with others, improve your ventilation. Consider pre-gathering testing and or high quality masking. Certainly if you're going to be in public spaces with members of the public, indoors, the best way to protect yourself is a well-fitted filtration mask like an N95, a KN95, or a KF94, and limit your time in that setting. Remember, those surgical masks are basically splash guards or dust guards. They don't actually filter anything out, and they certainly do not filter the SARS-CoV-2 virus. Remember, Medi-Cal redetermination started up a few days ago on April 1st, so make sure your contact information is updated so you can receive timely instructions and paperwork and not lose your healthcare benefits. Please do not show up to school or work feeling sick and exposing others. Stay at home, rest. That's the best way to go. If you must go out, wear a well-fitting N95 mask, as this is considered source control and will keep you from sickening or even killing another person. Remember, eat a balanced diet. Get some good exercise. Consider a multivitamin supplement. Get those baseline labs checked, cholesterol, diabetes. Ask to add a vitamin D level onto those labs to see if you need supplementation. And manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.